Welcome to Health System CIO's interview with Robbie Freeman, Chief Digital Transformation Officer with the Mount Sinai Health System. I'm Anthony Guerra, founder and editor-in-chief. Robbie, thanks for joining me today.
Thank you, Anthony.
All right, awesome. Looking forward to having a fun chat. You want to start off by telling me about your organization and your role?
Sure. So the Mount Sinai Health System, we are a large academic health system located here in New York City. We have 7 hospital campuses. We have over 400 ambulatory practices. We have the Icahn School of Medicine. We have the Mount Sinai Phillips School of Nursing, and we graduate school as well.
All right, and your role. It's an interesting role. Tell me a little bit about it.
Yeah, I get to work on the fun stuff, Anthony.
Yeah.
So I lead our digital and AI product teams, and so we're really focused on the experiences that we're bringing to life for our patients. So supporting the patient journey. That's everything that, including our app, My Mount Sinai. We have over 2 million active users. That includes the omnichannel experience. So when patients want to call us, text us, go on our website, go on our app. We also support the care team journey. So that includes tools like ambient documentation and the experiences that are in front of our clinicians. Along with that, we support the workforce experience, which we just launched this year, which is what are the tools and technologies that can support our 48,000 employees when they come to work? And so, for many years, we've been talking about the patient digital front door, but now we're talking
Mhm.
about the employee digital front door. So one of the things we're working on right now is having that one kind of seamless integrated front door for our employees. So they can, that's enabled by generative AI that can help them get to where they need to go or get their questions answered quickly and efficiently.
So that's sort of HR stuff that people would need as employees?
Yeah, so everything from I have a question about policy, or I have a question about my benefits, or I'm trying to navigate information that may exist in some dark corner of the internet. We're pulling that together to create one kind of seamless front door to support our workforce.
Yeah, and are you thinking of more of a Chat GPT type AI interface? I mean, that's really sort of one of the fundamental changes, I think, right, that we're talking about here is that that AI can give us a much more intuitive interaction with data and information.
That's right. So having a generative AI powered, interface, so you could ask what is our PTO policy, but you could also ask what is my PTO balance, and generative AI can help us reach into um, the business applications and bring forward that information in a way that's seamless.
So is it sort I think you've described kind of 3 buckets, 2 of which apply to employees. One would be their journey as they care for patients and making that easier, sort of the ambient AI and helping, capture the clinician-patient experience that takes the burden off of the clinicians. So that's one of the buckets that pertains to employees. The other one that pertains to employees would be their interactions with the health system as employees, more of that HR stuff that you just mentioned. And then there's what we've been talking about for a while, which is the digital front door and the patient interaction with the health system. Those kind of 3 buckets. Am I missing anything there, or is that kinda a high
Oh,
level?
that's right. No, that's right. At a high level, we like to talk about these as journeys. So it's the patient journey and the care journey and the workforce journey.
Okay, very good. So you got 3 journeys. Um, what's top of mind with you in terms of I'm sure you have act activity in each of those buckets or journeys. I use the word bucket, you use the word journey. So you have activity in each of those journeys. How you make sure how do you leverage governance, I assume, to make sure you're working on the right things in each of those journeys?
Yeah, that's a great question. And one of the things we did this year was we had a separate structure for kind of our digital governance and our AI governance, and we brought those together. And so now we have a unified digital and AI governance structure. And your question around how do we make sure we focus on the right things is such an important one. We have this framework that we call our experience led framework, which means going out there and talking to folks. So that includes things like focus groups with our patients, rounding and talking to the frontline team. Other asynchronous tools we could use to do polling and collect user experience kind of information asynchronously. And that helps us make sure that we're focusing our time and effort on the right pain points. We also have an organizational wide plan for transformation. So we're making sure that the priorities that we work on across those journeys are aligned with the organizational priorities. So I would say some of it is bottoms up, which is kind of out there talking to the end users. And then some of it is top down, which is staying aligned with the organizational priorities and goals.
Yeah, and that dynamic is an interesting one to come at it from both ways. Um, there's also sort of the lead versus follow dynamic, in sort of in terms of being responsive to what users want, and then also being visionary and perhaps
Hmm.
introducing things they might not be asking for, but they may want. And I always think of that as the iPhone, Steve Jobs' iPhone thing. It wasn't that anyone was asking for an iPhone, he had the vision. But
Yeah.
again, that's the exception as opposed to the rule. Usually the safer way to go is to solve existing pain points, to surface those pain points by talking with the users. And again, you made a great point. Bottom up from the users and top down from leadership. So a lot of ways to go about this.
That's right. And I think that we have to do both. I think you can't just do one. One of the ways we make sure that we're both kind of solving for current pain points, but also thinking about the moonshots and the big kind of ideas is by having a balanced roadmap. And by that, I mean, as we lay out our roadmap, making sure that it's a mix. It's not just kind of reacting, it's kind of a mix of having things that are proactive and but also making sure we're always working on optimizing for the current kind of any current pain points or challenges we're facing.
Yeah, one of the issues, there's so much change that could go on, that is going on. There's 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 sort of not conflicting goals here, but people in IT, people in innovation, people like yourself are tasked with change, creating change, positive change, hopefully, but change. You're not being paid to sit there and just sort of status quo. So you're there to drive change, and users, nobody likes change, right? Usually, people don't like change. You have to sort of convince. There's a lot of work to make change work. Um, and with all that's going on in AI and all, there's so much exciting things, and you're so deep in it. People in your type of position. I read an article today about an excellent article about, and this, the clinicians are going 100 miles an hour and have minimal ability and time to absorb change. So there's the dichotomy. They need change in order to be more efficient and take some of the load off, but they don't have any capacity to absorb the learnings that will help them use these new tools that should make their lives easier. What are your thoughts on that dynamic?
Yeah, I think that change management is where these initiatives either succeed or fail. And it's not really a secret that many of the kind of AI initiatives don't reach their full potential. And I think part of that is usually due to change management. And so I like to say that our projects, this work, is just 5% technology and 95% the people and process and change management. And so that is the also the thing that often determines how fast or slow we can move is our ability to make sure that if anything that we roll out, we have the right intensity of education, training, feedback. And so, I'll give you an example. One of the things that our AI team has been focused on over the past year is an internally developed AI product we built to identify which patients are at highest risk for pressure injuries. So,
Okay.
one challenge that we have is that we don't always know who may end up with in the hospital a bed sore, right, or a pressure injury. And we built an AI tool that can significantly outperform the legacy kind of tool where we, something that I used to use as a frontline nurse, asking patients a couple of questions using a tool called the Braden score. So we were able to show that we could outperform that with AI. Um, but once we have that initial model, that's not the end point. That's really the starting point. It's there where we're sitting down with our throughout this process with our frontline team members, making sure we can build it into a workflow efficiently, making sure that their voices are incorporated and embedded in that process, and that we can roll it out in a way that's sustainable. So we want to see a certain level of adoption before we continue rolling it out. So we'll usually start on one unit at one hospital, make sure we get the workflow right, and then make sure we have the right adoption as we roll that out. And then one last thing to say on this, and I think one way we get buy-in is by doing a really good job listening. And in this example, it was one of our frontline nurses who brought forward the idea. So anyone in our organization can submit an idea for an AI product, and we'll review it. And so one of the frontline nurses said, hey, this is what I'm seeing in my practice. Can we use AI to help keep patients safe? And we reviewed that, and we partnered, and we ended up working together to bring this to life. And so I think one way we can ensure we get buy-in and engagement is to make sure that we're creating tools that empower our team members doing the work at the front lines, and that our earlier point, we're really doing a great job kind of listening to the end users, and in this case, our frontline clinicians.
Excellent, very good. You mentioned the idea of rolling things out in a pilot, I guess a pilot type example where you start in a small amount of users or a small area, and then get some lessons learned and go from there. There's got to be, I assume, some thought into picking the right place to do that, where you have either people that are very receptive to trying things out or change. Some places have a specific innovation wing,
Mhm.
innovation wards. Not everyone can do that. I don't know if you have that, but tell me about your thoughts on, you know, picking the right areas to do pilots where, but you also want it to be representative. And I read something about this the other day where you can have a situation where you have champions in a certain area, you're dealing with them, you're rolling things out. They love it, but it doesn't take with the broader rollout because they weren't really representative of the general users.
Mhm.
So what are your thoughts around those issues?
Yeah. So we have created dedicated innovation units where we have some infrastructure, and that is oftentimes where we will start with a new initiative, and that's because we have some support built in. And
Right.
so though that could be at one of our community hospitals, it could be here at our, it could also be at our largest campus. And so those innovation units have been really important to kind of be able to collect feedback and have very frequent kind of check-ins on how things are going. But you're absolutely right that there can be this gap
Mm,
between what you're able to do in a pilot with a lot of support. It's not the same as what you're able to do at scale, where it may not be possible to have all that kind of support. And so we have to be thinking about right from day one, what is the environment in which this can scale, and what are the some of those success criteria that will be important, because we don't it never works when we just flip the switch and turn it on. We want to make sure we have some clear criteria around adoption and some clear success metrics, so we can roll things out in a phased approach and make sure that we are kind of hitting our success, our metrics there before we can scale more broadly.
all right, very good. I had a conversation with a CMIO recently, who kind of talked a little bit off the record about how difficult it is to get your arms around the whole training piece for these
Yeah.
technologies. Um, it's not an easy problem, and the resources you need, the money, to do this properly are rarely allotted because they would really blow out the numbers in terms of, you talk about we need a certain amount of dollars for a particular piece of technology. If you add in the true costs of training, it would be almost prohibitive and no one would do anything. So he's kind of described it to me as this is a real thorny problem out there, and even for him, someone who's been working on it for years, it's not something that's been conquered by any means. What are your thoughts around that?
Yeah, a couple of things. Oftentimes, we'll kind of lean on our vendor partners if we're rolling something out new and make sure that as part of our agreement and as part of that work, there's some built-in support. And
Mhm,
oftentimes, we can get some on-site, at the elbow, which seems to always work best when we can get folks, at the elbow. It's not always possible, but I also think that this is one of the opportunities for us to leverage AI to help support training and learning, and I think we can do it in a way that's much more kind of tailored and personalized with AI. We collect a lot of information around how folks are using the EMR, and we have a lot of tools. And so I can speak about the nursing world where we have a tool that we call NEATS, or Nursing Efficiency Assessment Tool, that helps us understand, are there people who need a little extra kind of coaching
mhm,
because maybe it's taking them a while to get through their documentation? And are there areas where maybe we've added too many clicks, too many flow sheets, too many buttons, because we've added and added right over the years. And we've been going through that data and looking for places where can we remove and who may need a little extra help. And that's been a really effective way to support folks. We've actually reduced the amount of documentation time by about 20 minutes over a 12-hour shift. It may not sound like a lot for a 12-hour shift, but when you scale that, when you look at that across 7,000 nurses and hundreds of thousands of shifts, that's actually a tremendous, amount of time that we can give back to patient care, or to make sure that people can, get their break and have the time they need to deliver the care for our patients. And so I do think that we'll see more opportunities with AI to continue to support our care teams, look for opportunity places to reduce the burden of documentation, and then get more personalized when it comes to training. Because I think, to your point, we probably have underestimated and we don't always get the intensity of support that may be needed, for training.
all right, very good. One of the overriding sentiments that I hear when I talk to people in positions like yours about AI and what's going on is they want to create an environment where almost it's like a safe place to play with AI. So you have to put in these guardrails, governance, security, um, all policies, procedures, and then you want to give the users tools and let them solve their problems. Let them leverage the tools to solve their workflow issues. You're not going to know from a top down, as we discussed, the top down point of view. You're not going to know all the nitty gritty little nuances of how AI could help them. So the idea is to educate them, to provide them with tools, provide them with the education on what the tools can do, make sure that they can't operate in a very dangerous way, so to speak, and then say, "Go have at it." And now talked to someone the other day who was doing promptathons and trying to let the users do that, and then sort of recognize the great things, and then maybe publish them out. And this made total sense to me in terms of a nice way to leverage your users to come up with great ideas, formalize those ideas, and then propagate that. So what are your thoughts around that dynamic?
Yeah, I think that this is where having a robust governance structure really helps. We have a centralized process for intake. I mentioned a little earlier that anyone can kind of bring their AI idea, and that intake then goes through a review board and kind of a structured process with the right guardrails. And so we know that AI tools are already making a huge impact all the way from bench to bedside to the back office. And I think for the back office and the administrative use cases, um, there's places where we can certainly lean in, and people can have more flexibility with things like they want to create their PowerPoint slides, or use AI to help support responding to emails, or working with Excel, and the Copilot tools that you get from companies like Microsoft, can work really well for that. They don't need as many guardrails. Um, but when it comes to clinical decision making, we want to make sure that we've really have a good understanding of how these tools are working. So we have a framework to kind of for each use case, each request, we can score, we have a risk scoring framework, and that helps us understand what level of assurance or testing are we going to need. And so for use cases, that require or relate to clinical decision making, we have a process to make sure that we can test it, understand how that AI works, understand the performance, check for bias before we use it for patient care. So we often call that a silent pilot or prospective silent pilot. So the AI model can run in real time behind the scenes. We can check how it's working, make sure that it meets our success criteria, and then start to roll it out for patient care. So I think the takeaway is that depending on the use case, there'll be a different kind of intensity of assurance that's needed. And then having a policy around the use of AI, so we have an organization wide policy, is important. So everyone kind of knows what is the process, and what are the expectations around how we're kind of using AI in a way that's responsible.
And what about the human in a loop dynamic? Of course, the closer we get to clinical care, the more we want that. But that's not, nothing that we have in place now is going to be that way forever. And you would only assume that as technology advances, these things are going to get better and better. And it would just be a natural tendency to remove the human from the loop wherever possible, wherever it becomes safe. What's not safe today that you would want a human in, 5 years from now, you may not even think of having a human in the loop. So we need processes and governance that's continual, right?
That's right. Yeah. So certainly the pace of change is very fast right now.
Mhm.
And we know that many folks are working on kind of general medical artificial intelligence. And so having that agile kind of governance structure helps us make sure that we're keeping up with the latest advances. I think right now, for all of our AI tools being used today, there's that are clinical in nature. There's always a clinician, in the loop that's making that decision, and then we'll have to see over time how that may start to evolve. Certainly, patients are using Gen AI. Certainly, patients are asking, ChatGPT and other tools and putting in their symptoms. We actually launched a couple of years ago an AI-enabled symptom checker. We call it Check Symptoms and Get Care. So today, patients can enter their symptoms. We use AI to match those symptoms with evidence-based protocols, and then patients are in the driver's seat for where to go to get their care. And we'll certainly see more of that, and we'll have to see over time what the regulators, are going to enforce and what kind of standards they're going to set. And we're gonna have to see how the technology matures.
Yeah, one of the other issues that I find interesting, I'd like your thoughts on, are this idea that you have a vast array of different types of users, some of whom now if it's not already, it's going to be not okay to practice medicine without leveraging AI in different ways. You have all these jobs at your organization, and pretty soon it's going to be not okay to be doing many of those jobs without leveraging AI. You can't just say, it's like saying, I don't use a calculator. Well, you're slower. So you, at some point, is going to be, if it isn't already, it's going to be part of the job to do it. You have to use it. You don't have a choice. So you have to bring some people along. Slow adopters you need to bring along. You've got people at the other end of the spectrum, your super users, your world-renowned clinicians, some of them who, are like, Robbie, where's this? Where's that? Why can't I do this? Why can't I do that? And you're saying, well, we're working on it. We're putting in the guardrails. It's coming. So some you have to sort of slow down a little, and some you have to move along. What are your thoughts on that? Is that an accurate depiction of some of the nuances you're dealing with?
Yeah, I think that's fair. I think that's also where that prioritization, we have an agile delivery process, so we can always make sure we're kind of working on the highest value thing. And as an example, right now we'll be planning for kind of what we'll deliver in the fourth quarter of the year. And so that allows us to make sure that, within any 12-week kind of period, we can always flex to work on the highest value use cases. But yeah, that's certainly going to be things are moving so quick. Epic had their user group meeting just recently, and a lot of new announcements there. And so we're trying to really leverage that agile portfolio and governance to kind of keep up with the latest and always ask ourselves, what is the highest value thing we could be working on right now? And that changes quarter to quarter. And that is one of our biggest kind of challenges is how we can continue to like have a great process there for prioritizing and
Yep.
make sure we're working on the right things.
All right, Robbie, that's awesome. That's about all we had time for today. So I want to thank you so much for your time. I hope we can catch up with you again down the road.
Thank you, Anthony. This was a great conversation. Take
Have a
care.
great day. Thank you.